Welcome to the Next Chapter Retirement Podcast, where we discuss smart strategies for building and protecting wealth, health, and well being, helping retirees shape their next chapter into their best chapter. I'm your host, Mark Erickson, and each week we help you navigate the big decisions that shape your future, from health and financial planning to Medicare and lifestyle design and everything in between. Let's go ahead and dive in. Today, I want to walk through the 5 most common and most expensive Medicare mistakes that I see people make. These aren't rare situations. These are things that happen every day to good, responsible people who just don't have clear guidance. The first mistake is missing your enrollment window. Now, your Medicare enrollment window is going to change or differ a little bit, I should say, based upon your unique situation. From the very basics, you're going to need Medicare Part A and Medicare Part B. And Medicare Part A, as you can see, is considered hospital insurance, which is pretty obvious. That's going to cover hospitalization. Medicare Part B, they call medical insurance, and it might more accurately or descriptively be called outpatient medical because it's going to cover things like doctor visits, urgent care, emergency rooms, labs, imaging, even procedures performed in a hospital but on an outpatient basis are all going to fall underneath Medicare Parts A and B. So very important to have both of those. Now, in terms of your enrollment, if you are already receiving retirement benefits through Social Security, you should be auto-enrolled in Medicare Parts A and B, and you should automatically get your ID card roughly 3 months prior to your birthday. But for most other people, the situation is going to depend upon how they have their insurance today. If you work for an employer, or if your spouse, if you have coverage through a spouse who is an employer with 20 or more employees, then you actually can keep that coverage if you want to. You're not required to sign up for Medicare Part A and B. Again, if you or your spouse work for an employer with 20 or more employees, and if your health insurance coverage is through that employment. But for people who are going to be turning 65 and they have their coverage through their or a spouse's employment with fewer than 20 employees, or if they have their own individual health insurance, then you will want to sign up during what Medicare calls your initial enrollment period. And that's generally when you turn 65. It is possible to get Medicare before that if one is disabled, but for the vast majority of people, you would get the coverage around when you turn age 65. So you can see that Medicare.gov says that your initial enrollment period begins the 3 months before you turn 65. It includes the month that you turn 65 and 3 months after you turn 65. But from a timing perspective, you want to apply for both Medicare Parts A and B 90 days before the date you will turn 65. So you cannot apply any sooner than 90 days before the date you turn 65. And ideally, you do want to apply sooner than later because it is a process. And often it takes a good 30 days from the date you submit your completed application to Social Security before you will receive your new Medicare ID card for Parts A and B in the postal mail. Now, for most people who have worked or they have a spouse who has worked 10 years, they will have paid their Medicare payroll taxes, again, through their or a spouse's employment for 10 years, and they'll be eligible for free coverage for Medicare Part A. However, Medicare Part B is going to have a monthly premium, and we'll talk about that more here in a moment. If you are receiving retirement benefits through Social Security, it's very simple. Then your Part B premium will be subtracted directly from your Social Security benefits. But for those who may be deciding to elect their retirement benefits later, those people will want to sign up for something called Medicare Easy Pay. And as you might imagine, it's just signing up for a automatic monthly withdrawal from a bank account to pay for your Medicare Part B premium. And that would continue until such time that you would start receiving retirement benefits from Social Security. Then the Easy Pay will stop. Then they will start deducting your Part B premiums directly from your retirement benefits. So very important to get that timing right for that initial enrollment period. Mistake number two ties right into that, and that is missing your enrollment period. This is something that can actually create permanent consequences. There's actually late enrollment penalties that the government can and will charge most often for the rest of your life if you do not sign up on time. So, like most things in life, timing is everything. Now, as I said, most people do receive premium free Part A, but there are some people who did not work 10 years, or they didn't have a spouse who worked 10 years and paid the Medicare payroll taxes. And those people can still get Medicare Part A, but they're going to have to pay a premium for it. And if they do not sign up on time, their monthly premium can go up 10%. And in this case, the penalty could be applied for twice the number of years you didn't sign up. Now, for Medicare Part B and for Medicare Part D, the consequences are even more dire. While the penalty can be an extra 10% for each year that you could have signed up for Part B, then for Medicare Part D, you can actually have to pay that Part D premium literally for the rest of your life. So again, very important to sign up for Medicare A, B, and we didn't really talk about D yet. We'll get more into that later, but Part D is the prescription drug benefit, and very important to sign up for that on time. Where people will sometimes run into issues with Medicare Part D is I often see this for people who say, you know what, I'm not taking any medications, or my medications are so inexpensive, I don't want to sign up for Medicare Part D. That is a huge and terrible mistake, particularly because there are often Part D plans that have a $0 a month premium and can help save them money in case they do need a prescription. But more importantly, if they don't sign up for Part D, whether it is a standalone Part D plan that one would get along with a Medicare supplement, or it could be a Medicare Advantage plan with an embedded Part D benefit, you definitely want to sign up for Medicare Part D when you're eligible to avoid those lifetime penalties. Mistake number three is not budgeting for income-related monthly adjustment amounts, which we often call IRMA. This is something that can be a big surprise for higher income retirees. And the way that IRMA works is, if you can see there's a table here, and this is at the CMS.gov website. And we could see that a single tax filer or a couple that filed a joint return, and by the way, they always look at your modified adjusted gross income for the tax year 2 years prior. So for 2026, they'd be looking at the 2024 return. And if the income for a single filer is 109,000 or less, or for a joint return, 218,000 or less, they would pay the base premium, which for 2026 is 202.90. These numbers will change a bit each year. But we could see that if somebody earned more than that, then there would be an additional income related monthly adjustment amount. Again, these are Medicare Part B premiums. So if we add the 8120 to the base amount of the 20290, that's where we're going to get the 28410. And you can see that the IRMA surcharges go up, capping out at 487 a month for a single tax filer, or 689.90 a month for a joint return for people with incomes, 500,000 for a single tax filer, or 750K for a joint return. So these are pretty big monthly recurring amounts, and certainly something that need to be budgeted for, and something that you want to think about when you're doing your tax and financial planning before you retire. So again, that's an area where the coordination really matters. And while IRMA applies to Medicare Part B, it also applies to Medicare Part D. And we can see the amounts are much less than we saw for the Part B IRMA surcharges, but those are going to be premiums that would have to be paid even if somebody signs up for a $0 a month Part D plans, which there's a couple very popular plans that do have a $0 a month base premium. But if your income was higher than say 218,000 for a couple that filed a joint return, then you're going to pay this one of these amounts based upon your income. Mistake number 4 is simply choosing the wrong plan for your unique situation. This is a very common mistake that we see happen, and it can have lasting repercussions that can sometimes come back to haunt people literally for the rest of their lives. What happens often is that people, as they approach age 65, you just get this marketing onslaught of all these companies and insurance agents and brokers sending you out materials that are put together by professional marketers, and they are very, very appealing. You will get ads talking about $0 a month premiums with zero deductibles, and those plans absolutely exist, and they may or may not be the right plan for you. While many people will just simply look at one of those advertisements, or go to a seminar and see a marketing pitch for it, you want to be an educated consumer. You want to know what the upsides and downsides are, to whether you go with, really, you have two different basic options. You can go with a traditional Medicare supplement, like a Plan G Medicare supplement. These are sometimes referred to as Medigap plans, and that's going to give you the most comprehensive coverage that will work with original Medicare, giving you really two chief advantages. It's going to give you the best financial risk mitigation, as well as give you incredible access to providers, as you would be able to go to any provider in America that takes original Medicare. And that's going to include almost all hospitals, the vast majority of specialists. With primary care doctors, that's a bit of a question mark. And I always encourage people to call their primary care provider and ask this simple question: do you take original Medicare? Now, if you do decide to go with a traditional Medicare supplement, and prices and companies will vary, that's something you want to work with a good agent or a broker to make sure that you're getting not just the plan with the lowest premium, but also coverage from a good carrier that you're going to be happy with for years to come. But if you do get the Medicare supplement, you'll also want to get a standalone Medicare Part D plan. And the right Part D plan is always going to be determined solely by the medications that one is taking. And fortunately, the government put together this fantastic tool at Medicare.gov, and it's called the Medicare Part D Prescription Drug Finder. Very easy to use. You can just put in your zip code and say you're looking for Part D. For most people, they will say, I don't get any help from these programs. Yes, you do want to see drug costs, of course. Then you just simply enter in the medications. And then this Medicare.gov Part D prescription drug plan finder tool will look at the medications that you're taking, and then it will tell you which plan is going to be the optimal plan and result in your lowest out of pocket costs. And generally speaking, that's the plan that you want. Quick little aside, it will also ask you to select your favorite pharmacy. Do yourself a favor though, but select all the popular ones. In Colorado, I always recommend that people look at, Walgreens, CVS, King Supers. You could also put in Walmart or Costco. The reason why you want to put in these most popular pharmacies is that sometimes you will discover that your prescriptions could be significantly less at one pharmacy versus another. So certainly that is valuable information for you as you go through the process of determining which plan is going to be best for you for Medicare Part D. Now, the other option is, and this is the one that you get the majority of the marketing information about, are the Medicare Advantage plans. And Medicare Advantage plans do have some appeal, chiefly in terms of that advertised $0 a month premium. But of course, we know there's no such thing as a free lunch in this world. And the way that they can offer these plans with $0 a month premiums and $0 deductibles is the plans will have rather significant out of pocket maximums, and they will typically work with some sort of network. So you need to make sure that your providers are in network. If you do want to go with a Medicare Advantage plan, be sure to go with one that has an embedded Part D prescription drug benefit. Very, very important. Now, the out-of-pocket maximums on the Medicare Advantage plans, they commonly hover between, $3,000 and $7,500 or more. So that's something to be aware of. And although they do have plans absolutely with the $0 deductibles, you do want to look at the copays and the coinsurance. As an example, the copays can be hundreds of dollars per day for hospitalization, often with days 1 through 6, as well as there can be significant copays for things like outpatient surgery, MRIs and imaging, etc. Kind of the real big deal with Medicare Advantage, though, can really often come down to the network. And this is something that we often see where people will get phone calls from people who signed up with an Advantage plan because they were attracted by the $0 a month premium. And as I often say, the reality is as we get older, our health tends to not improve. And lo and behold, they develop a serious illness or injury and they need to see a particular specialist. And guess what? They're not in network for their Medicare Advantage plan. Depending upon the nature of their illness or injury and the timing of it, while their Medicare supplement, like a Plan G, could be guarantee issue within the first 6 months of their Medicare Part B start date, or after their very first year on a Medicare Advantage plan through a special enrollment period called Trial Right. After that, then if they wanted to try to get onto one of those excellent Plan G Medicare supplements, it is almost certainly going to be subject to medical underwriting, and which means they may not be approved, depending upon the nature and severity of their illness or injury. And in some cases, people can effectively wind up trapped in the Medicare Advantage world, sometimes for the rest of their life. And their only option, their only guarantee issue option, and there are some caveats even with that, would be that they might be able to change from one Medicare Advantage plan to a different Medicare Advantage plan during the open enrollment period in the fall or the special Medicare Advantage enrollment periods, the annual enrollment period between January 1st and March 31st. So, very important to make sure that you're choosing the right plan for your situation. Oftentimes, people, if they're not making the decision based on what, an advertisement they got in the mail, they may be just simply picking the same plan that their neighbor got because they're happy with their plan. But while their neighbor could be happy with their plan today, life circumstances have a way of changing over time, and they may not be happy with that plan in the future. So this is something where you really are going to be best served by talking with a qualified agent who's going to ask you the right questions to truly better understand your situation, your budget, your needs, and make a good recommendation for the best plan for you for the future. And that ties into mistake number 5, which is not reviewing coverage each year. If you're somebody who signed up for a Medicare Plan G plan, that is something that most cases you literally would keep that plan often for the rest of your life. But remember, you're still going to have that Part D plan, and that Part D plan, or if you have a Medicare Advantage plan, those are plans that absolutely need to be reviewed every single year. A couple of things could happen. The medications that you're taking could change from one year to the next, or the plans themselves, whether it's a Part D plan or a Medicare Advantage plan with an embedded Part D benefit. Those benefits can change from one year to the next. The networks can change from one year to the next. So, again, that's something where you want to be a smart consumer and go to the Medicare.gov website and make sure that you're the right plan for the coming year. And again, that's something that a agent or broker can help you with. So if there's one theme that is consistent across all 5 of these mistakes, it's this. Medicare isn't complicated because it's impossible to understand. It's complicated because the rules are not always intuitive, and that seemingly small decisions can sometimes have long term, even lifetime consequences. And by the way, if you're listening to this and realizing that you're not totally sure where you fall on this on the timeline, I put together a simple Medicare enrollment checklist that walks you through everything step by step. You can grab that free enrollment checklist at nextchapterpod.com. And by the way, if you're a Colorado resident and want help thinking through your specific situation, I'm always happy to have a conversation and point you in the right direction. Thank you so much for tuning into the Next Chapter Retirement Podcast. If you enjoyed today's episode, be sure to like and subscribe and share it with anyone planning their next chapter. We'll be back soon with more conversations to help make your next chapter in life the very best chapter. And until next time, plan wisely and live fully.